good evening, everyone. It's really great to be asked to come and have a chat about this. So as Galia said, I know quite a few of you guys, I would imagine. Those of you I haven't met, it's very nice to meet you. And welcome to this. The key thing is, as Galia said, I was asked to sort of have a chat about maybe some of the more practical stuff. I think the first thing to say about that is we're all living in a very, unprecedented times, uncertain times. The truth is that decision making in this is really hard, because the reality is that everything we're doing is based on information we're given, and then we have to make decisions. None of this information is complete. None of it sort of allows for every eventuality. And you guys are living in a family situation which is different from a lot of other people. So it's very important to understand that sometimes the decisions you make are absolutely the right decisions. And that's regardless of how you look at it. You made the right decisions for yourself at the time. But the hope of this is to try and open up some of those issues and try and have a look and say, well, what are the thoughts about this? But obviously a lot of this is my opinion. So obviously I'm looking forward to hearing some other people's opinions and some questions. And as usual, I'm here to try and support everyone. And I hope that's how it's taken. And I'm looking forward to us having a little chat. So here we go. So what I wanted to talk about today is kind of the current government advice, it's stuff we probably all know, stuff we're hearing on the news, stuff that we're hearing from other people, and really just a sense of what the situation is currently. You can't pick up a newspaper, look at the news, talk to anyone without discussing this matter at the moment. And then really the second part is the more functional bit, which is to get on and talk about what life is like at the moment for everybody, and where some of the issues might be and what some things might help to think about, and what resources are available, some resources available to try and help maybe with some of those difficulties, if in fact you're having difficulties. One of the things I have to say is there have been some things about my life in the last few weeks since we were locked down that I think have been better. I think I've had more time with my children. I think that I've had a better chance to stop and think. I've eaten more meals at my dinner table. But, alongside that comes the pressure of spending too much time with my kids. And, and all of the normalities that come in a family situation is that we're used to our life. We're at home with the children, or we're at work, or we're able to go out and have our run, or go to the gym, or go to the cinema in my case. And actually those things have been suspended and broken. And those are the things that maybe help us get through our day to day. So, it's a very, very difficult, tricky situation. So we're going to talk through these subjects that are on the screen now. Okay. And there are some questions that we were asked by email that I'm going to cover at the end. So the update from today is still the same. We should only be leaving the home. This is every person in the UK. We should only be leaving the home for key work duties if we work in a job which cannot be done from home, or which is considered a key working role. Doctors, nurses, etc., delivery drivers, supermarkets. We all kind of get a feel for that. So those are the people that should be leaving the home potentially on a daily basis. That ideally people should only be shopping once a week, if at all, with the ideal that people will have their food delivered, if possible, to get a slot. So ideally we should be shopping minimally, and that we should be taking daily exercise. The ideal would be that any person, even a person that is deemed to be considered to have COVID-19, can have daily exercise and should be able to get out of the home. Now, there is no stipulation on how long this should be, or, for instance, where you should go, except for the fact that people are saying that geographically you should stay in your own locality. So, for instance, myself as a Londoner, in some ways I've got less space than someone maybe who lives in rural Cumbria, but it depends on the situation. So there are benefits to living rurally, but I think there are also benefits to living in a town or a city in this situation. And then there are a couple of things that I felt were relevant potentially to Dravet syndrome, and one of them is about face masks. And I see a lot of people wearing face masks. At the moment, our government's guidance for the UK, there's been no strict or complete guidance on whether to wear a face mask or not. I have to say that I believe in people, in all people. I see many people incorrectly using face masks, and I will include myself potentially in that list. But I believe that for children and for people maybe who have a learning disability, that wearing a mask is very counterproductive at this time, because it involves people touching their face a lot. removing the mask, putting the mask back on, taking it on, taking it off, and actually you risk more transmission of potentially getting the virus onto your hands or somewhere, and actually then transmitting it into an area which can take it into the body. So the reality is that face masks are not ideal, and I cannot imagine many of our young people wanting to wear them and struggling significantly with them. So my 3-year-old son had to wear one this morning to have his immunisations at the GP. I'm glad it was only about 4 minutes of his day. So we should be very clear about that. And then social distancing. So again, the key thing is that for some people, social distancing is not going to be something that they are going to be able to follow. You know, young children, children with disability, adults with a disability or a mental health problem or mental health challenges are not going to necessarily be able to keep to these rules. And that's something that as a society, we need to be able to understand. And one of the things that we need to be very good about is that as parents of children who maybe don't understand the situation, we need to be in control and obviously helping them to make sure that they're social distancing as much as possible. You know, in the end, you turn a corner of a road, there are people there. These things are going to happen, and they do happen every day. The job here is to try and minimize contact, okay? So we should always be thinking about that. And then the next thing that I was kind of thinking about, and I've noticed a lot, is that I've actually been more on social media. I've been more talking to my family. I've been more talking to my friends than I probably have done in the time before the lockdown. And one of the things that I feel I've seen and I've noticed amongst people I've spoken to is that actually there's quite a lot of social pressure at the moment, both through social media and maybe our close social relationships, in terms of the way that people are viewed. And that actually sometimes, you know, at the moment, getting too close to someone is seen as almost like a negative thing, which of course it is because you're supposed to be social distancing. But I think that's very hard. And that's a very hard thing to get used to. And I think that sometimes maybe if you have a young child or you have someone in your family who has a learning disability who doesn't understand social isolation, this is potentially a concern for people when they go out, that actually they're concerned that their family member may actually break someone else's social distance, and actually that person may respond negatively. And I've certainly seen that sort of out on my walks with my family and stuff like that, that there are sometimes issues. And I can imagine that that's an anxiety for people when they're thinking about leaving the home. Also, I have a thing about people leaving the home too often. I think that I've seen situations with friends where they've spoken to me about neighbours that have kind of maybe mentioned something to them about they feel that maybe they're leaving the home too often, but actually they're key workers and maybe their neighbours don't know that. And again, you know, what we have to understand here is that every family who is living with this in this country is having to make decisions about when they go out, when they don't. And of course, you know, a lot of stuff on the news is people having parties or pubs having lock-ins, and I think those are very few and far between. But I still feel there is some pressure potentially on people that maybe have to go to the shops every day, to go and collect medication from the pharmacy, to go to a hospital appointment, to go and pick up a loved one who's a carer, or, you know, because they don't drive or whatever it is. So I feel there is a perception that might be adding to people's anxiety around the way they're perceived at this time. And I think there's lots of discussions on social media. Things really get whipped up in terms of, you know, things being sent around to people. You know, it just gets more and more likes, more comments. And sometimes people can end up feeling like maybe they're being seen as negatively because maybe they've done some of the behaviours that are being seen. But I think that in family situations who are living with a young person or a person in their family who has significant medical needs, learning needs, physical needs, that we have to understand that, of course, we shouldn't have to explain ourselves all the time. That actually our life is complex, or the life is complex, living with someone with disability, and therefore it's very appropriate to leave the home often if you need to. But in saying that, also, it's very important to understand that we're all members of this community, and therefore our job is to kind of also keep ourselves, you know, following the rules as much as possible, staying in where we can, and making good decisions. So, as I'm sure everyone has seen, these are the key things to remember on a day-to-day basis. Good hand washing as much as possible for 20 seconds when you leave the house, come back to the home, and in between any trips out, going to the hospital, picking up medication, whatever it may be. When I come in from the hospital, I've been working some shifts in the local hospital, and I come in and I have a shower. The first thing I do when I get home is I take off all of my outer clothing, put it into the washing machine, put the wash on, and have a shower. And I feel that's the best way to try and minimise my bringing in the potential for something for the COVID-19 on my body. And then ideally using tissues for coughs. Hands worst case scenario, and then washing your hands, and again avoiding touching of the face, which is very difficult maybe for some of our young people with Dravet syndrome, but trying to minimize the touching of the face where possible. And again, all stuff people knowing the symptoms: high fever or persistent non-productive cough, then therefore people should isolate for 7 days. If they are the second person or other people in the household, they should then isolate for 14 days. And that is to allow themselves to have an incubation period where they have not quite gone into the symptomatic part of the condition yet, and then 7 days to have the illness itself. So 14 days if you're a member of a household in where someone is suspected to have COVID-19. Where I find that the guidance isn't clear is about whether you've isolated already and the people within the home have isolated already. If that second person, if another person in the home presents symptoms after isolation, do you have to re-isolate? At this stage, we are assuming you do, but that does mean it has a huge impact on key workers going to work, people being isolated constantly. So that is a significant factor, but these are the current guidelines for isolation. And one of the things that I really thought was important to follow up from Professor Helen Cross's webinar was about vulnerability, because I think this is a really important and probably one of the key issues for families that have a child or a family member with Dravet syndrome, which is that actually how vulnerable is someone who has Dravet syndrome. And as we always talk about with Dravet syndrome is a spectrum, and everyone on that spectrum has different needs. And one of the things here is that we shouldn't necessarily be thinking of it as Dravet syndrome in itself. We should be saying, okay, what are the risk factors? What are the risk factors for my family member? What are the things that make them more at risk that if they do get COVID-19, in whatever way, what is it, how risky is that for them? And therefore that might help us to understand more about where we should be more careful. Maybe we should isolate in the home all the time. But actually the key thing here is about the comorbidities. And comorbidities, if people don't know that term, is basically the other problem someone has. And really the key two I've put in red here at the top of the screen, which is about chest health. And when we talk about chest health, what we're talking about here is recurrent chest infections, chronic lung disease, chronic obstructive pulmonary disease, issues where you get chest infections over and over, you have poor breathing reserves or poor respiratory function, severe asthma, for instance, using inhalers every day, blue inhalers and using brown inhalers every day would be considered part of that. Tracheostomies, ventilation, obviously, anyone on CPAP at night, the ventilator mask should definitely be considering being very serious about the way in which they're isolating. And then secondly to that is mobility, because by having restricted mobility, being a full wheelchair user, not having good muscle tone, not being able to have good stance, this puts you more at risk because you're not as physically active, you're not up on your feet, you're not getting that lovely natural physiotherapy in your lungs, which is what happens when we all walk about, is that makes us bring up a lot of the stuff that's in our lungs. So these two factors are probably the two key factors that lead to poorer and worse outcome with COVID-19, or potentially more risky having the condition itself. Many of our young people, if we look at evidence from China, show that, and from France, show that children are very, very, very strong and very good at getting over this. Even children with very complex needs can just go straight through COVID-19 without us even knowing it, or with having very mild symptoms. So the key thing here is about making a decision about your young person or your family member and deciding on them. In terms of chronic neurological condition, Parkinson's disease, motor neurone, multiple sclerosis, we're talking here about people that are further down their illness, who have got more severe needs because of those neurological conditions. So in itself, having a learning disability does not make you more at risk. There are people that have a learning disability who are fully physically capable and able, and therefore they are at the same risk as other people. The issue here is about the things that come with having a learning disability, which are often impaired mobility and from that poor chest. So that's the way to understand the vulnerability guidance, and not everyone with Dravet syndrome therefore is ultra vulnerable. The second issue, of course, is the seizures and the risk of fever, and that, of course, is a real issue, and that therefore, of course, makes everyone with Dravet syndrome to a degree vulnerable. But the key vulnerabilities are these two. So on saying that, I think one of the key things next is to say, well, how do we manage this? How do I make sure that the very important person in my life that is vulnerable, or more vulnerable than someone who doesn't have Dravet syndrome, how do I get this right? And at the moment, as we know, the goal of the UK government is to reduce the transmission of this virus, to try and create not an overwhelming situation for the health service. And when we talk about overwhelming the National Health Service, we're not talking about just ventilation and COVID-19. What we're saying is that people with epilepsy still need support, people with cancer still need support, people with heart conditions and all of that stuff. We need to create enough space in the health service that everyone can still have the care that they absolutely require, as well as managing this pandemic and making sure that everyone who needs respiratory support, ventilation, intensive care can have it. And so therefore, the key thing they're saying here is, but all this social distancing is basically trying to minimize transmission. So of course, everyone's first priority is to say, right, I've got a potentially vulnerable person in my household, I need to make them safe. So that's absolutely correct. And there are two risks. One is when you leave the home, you risk getting the virus. That could be from someone you come into contact with, which is why social distancing is in place, or giving the virus to someone. And that's the other thing we have to be aware of, is exactly what we're saying about being part of a community, is that our job, our truest brave thing to do, is to stay at home as much as we can, understanding that there are other factors involved that we're going to talk about shortly. But actually staying at home, doing nothing, staying away when we're tempted to go to the shops, or tempted to go out on a long drive, or tempted to go to our second home, not that many of us probably have one. The reality is we should stay at home. But where we have to be sensible and good is we have to say, do you know what? I need to go out. My children need to leave this house today, because you know what? This is starting to have an impact on them. We have to create a routine and a structure, and we have to get them outdoors. Okay, we have to get some sunshine into them, some vitamin D and some endorphins, and that has to happen, because otherwise this is not going to work. So everything here is about making a decent risk assessment. Okay, so therefore a common sense approach to this is the best way forward. So what we have to say is, you have a person with Dravet syndrome within your family, what's needed? So firstly, the mental health of the family can deteriorate if you stay in all the time. Okay, the reason that the daily exercise has been agreed is because it is kind of universally understood that for all people, getting out is a good thing. It is good to get out and just get in the fresh air and get out there and take a breath outside of the four walls. It breaks the day up, it creates a break. So that's really important. And again, you know, some people need to run, some people just need to walk, some people just need to be pushed. That's fine. Whatever works for you is fine. I've gone back to putting my 3-year-old son in a traveling backpack on my back, because I frankly just, until we get to where we're going, I don't really want him to be running up and down, because it's just harder to do and it's more stressful for me and more stressful for him. So, you know, we've gone to that. So whatever works, you can do that. You know, and often once we're in a place, we stay there, and that's kind of where we go, and then we go home. But that's enough for us. So thinking about everyone's needs and what's best. And then one of the things that I deal with a lot in my job at the moment is managing and supporting people that have care teams. And quite a lot of the care teams that I work with, you know, families have suspended them for 2 weeks or 3 weeks and said, you know what, we just need a break. You know, this is too stressful. Some people have said it's It's stressful because I'm worried about the carers and I'm worried about them getting something, and I'm worried about us risking them. And they sometimes feel that isn't the right priority. My priority should be to my family. So, but other people have said, you know what? I need my carers. My carers are so central to my life that I must have that care. And if my carers are willing to come and my carers can come, then that's what I want them to do. And I think that neither of those decisions is the wrong decision, but I think that we have to make sure that we're really thinking very wide and saying to ourselves, you know what? I need to not just think about COVID-19, because that's an easy decision. I'm just not going to let anyone in the house and I'm not going to leave the house. Easy peasy. But the issue is about all the other stuff, about mental wellness, about sleep, about making sure that everyone's getting some time every day. So that's a decision that everyone has to make, but we're going to talk about that shortly. And then obviously behavior. Now, it's easy to jump to the idea that a child's behavior or a young person's behavior might get worse. And that's, of course, very possible and very, very likely. The other thing is that their behavior may improve. And I suppose some of the concern might be that after months of this, are they actually going to want to go back to school or to college or to residential or to wherever they go? And that's something to think about later. But, you know, in terms of managing behavior, there are some resources we're going to look at. But it's very important to take the fact that you guys know far better than me the impact of what challenging behavior can do, particularly if you're stuck indoors at home. I think it's really important for us to understand that the domestic violence and abuse will increase through this time. That's just a fact of it, is that people are stuck together who would normally get chances to leave the home and be in other environments and come back. And that disabled children are very at risk here. You know, this is one of the highest risk groups of abuse in the country. And I think that this is not about willful abuse. We're not talking about people being willfully abusing. We're talking about people being put in an impossible situation. And the thing to understand is this is exactly why we're talking about this common sense approach, is that literally all of us have a breaking point. All of us have a point where we can't go further, that actually we're going to get to the end of our tether. And you guys, the respect I have for you guys as parents is boundless, okay? But we're human, and that has to be understood. And this is a unique situation. None of us have been through this in our lifetime. None of us have been in this situation in the way that it is now. And so we have to understand that this is why it's so important. There are things worse than COVID-19. And COVID-19 is serious and it's a threat. But we have to understand that there are other threats and that we mustn't allow ourselves to just sort of get steamrolled by COVID-19. We have to remember that there's a lot of moving parts here. And then siblings, I just think that, I mean, I feel so sorry for teenagers at the moment. I think being a teenager must be really hard because everything you do is about seeing your mates and being part of something. But I think for siblings as young carers, as you know, most of your other children will always be carers. That's just the nature of the family they live in. But also, I'm sure you're also very aware of the way and the burden that has on them. But at this stage, of course, that's going to be very acute. But we're going to go on and talk about the siblings as well. But I think they also need very special consideration at this time, as do parents. So thinking about family mental wellness, I think one of the key things here is about people trying to find new coping mechanisms. I have to make a confession now to Helen and Galia that we talked about putting some graphs on. I just haven't had a chance to do it. I'm so sorry, because my children have been going nuts. But the truth is that, you know, the easy things are often not the good things. So Homer Simpson here is binge watching Netflix and eating pizzas and drinking beer, and those things are fantastic. I mean, like, they're the best, right? But they're not necessarily going to be the best thing for us if we do them every day. So again, you know, it's about saying, I need a coping mechanism. I've noticed that running has become the ultimate hobby in the UK since exercise once a day was introduced. You know, everyone's jogging now. My 90-year-old neighbour's been out having a little run up and down the street. So, you know, the truth is that everyone's finding new ways of trying to cope with this. So I think it's really important that everyone tries to get some pressure relief every day, whether that be reading a book, sitting in the garden on your own for 10 minutes having a cup of tea, going for a run, going for a bike ride with your children, going for a bike ride on your own, taking the dog for a walk for the 5th time in the week. If that's what you need to do, do it. Because if that's what's going to get you back in the house and in a good space, go for it. Because that is more important. I think it's better at this stage that children have more screen time for a little while longer to allow a parent to go out and have some headspace than it probably is to say, oh, I've watched too much TV today, I better just stick in. This is a marathon, not a sprint, and we need to make sure that people are able to have a little bit of time every day. And then I think it's about balance. I think the other thing that I've come to notice very much from this in my own way is that I've had a lot of expectations of myself, of being at home, and therefore I should be able to fix the shed and I should be able to write all these pieces of work that I've been meaning to write for ages, and that I should be able to get really fit and look like Joe Wicks, if that's your dream. But the truth is I don't look like Joe Wicks. So, you know, and I'm never going to look like Joe Wicks, but if I tell myself I will, I'm going to disappoint myself. So I think the key thing here is I've noticed that really my days go by very quickly. The days are fast, you know, they go by real quick. By the time I've looked, it's 4 o'clock in the afternoon. I'm sure you know that experience very well. And actually that just has to be okay. Like, I think that, you know, I think we have to be very aware of setting ourselves up to fail. And I think the best thing is to just try and take your hands off any vision you have and say, do you know what, if I get the chance, I'm going to absolutely smash that. But the reality is I might not, and I just have to be all right with it. And I think that might be my biggest coping mechanism at this time. And again, you know, increased in consumption of food, you know, alcohol, screen time, all of these things, as we've talked about, we need to make sure they're balanced against exercise, as much sleep as we can get. Again, very difficult to do in your situations. And making time for ourselves and making time to spend quality time with our children and our other family members. I have a busier social life now than I did before, because I'm always stuck indoors because I've got small children. So now I suddenly realised for the next 5 nights I've got something on every night, and I'm not used to that, and that's kind of messed me up a bit. That actually I just want to watch a film, and I've been in 3 weeks and I haven't watched a film yet. So, you know, again, those expectation managements is that life is a bit different, and that might mean you're busier than you were before. So it's just about accepting that, finding a good way around it. Now, these slides will be shared. So these resources are all resources that I was recommended by the psychology team at Great Ormond Street. So I think there's some really good stuff. I had a look over them, and these will be good resources going forward, but you'll be able to grab these from the slides. And then really moving on to kind of risk assessment. So talking about leaving home, you know, I personally feel everyone should go out every day. We've talked about that. But keeping lockdown in mind and keeping social isolation in mind, I think the best way to approach this situation every day is to say to yourself, do you know what? I'm about to make a decision about going to Tesco's or about going to the park or about, and actually all you have to do is say to yourself, is this worth it? Is what I'm about to do worthwhile? If it's that I have to get out of the house, then yes, it is. I have to go. If it means I'm going out twice today, you know what? If you have to, you have to. That's that. Because if that's what you need at that moment, that's what you need to do. The key thing is to try not to overdo that. So always think about the benefits and the risks to yourself and to people outside and to the other people in your household. But talking medically for a minute, one of the things that we've noticed in the hospital is that A&E is quite quiet. And that's a really good thing. But it's a bit too quiet, actually, in some ways. And I think that one of the things that we've seen in my local trust is that actually we've had children coming in quite unwell, who have actually come in later than they should have done. And these have both been children that have lived with, or the multiple, these are only the 2 I know about, multiple occasions. These are children with long-term conditions where the parents are expert parents. These are parents that know their child inside out, and they've made the decision to stay at home. And actually, the one thing I would say to you, and following on from what Helen said, I think that we should be doing our best to agree a plan for our individuals in our family and say, do you know what? I'm not changing my plan. I'm going to keep it exactly the same. I think that would be extremely reasonable at this moment. The second thing to say is, in some ways, I might speed up it. I might say, do you know what? I'm more worried than usual. I'm going to go in earlier. But I have to say that so far, what I've seen around the country as well is A&E departments saying to people on social media, we're open for business, because actually they are surprised by the lack of admission they've had. And I think that what we should be thinking about really is about, my child's needs have not changed. They are the same as they were. And if my biggest fear is about entering a hospital because of COVID-19, I believe there are worse things than that. And I think that if your child is potentially going to go into status, or if your child, then therefore we risk more the potential of going to a ventilated area, which, to be honest, is the highest risk. So I've done multiple paediatric shifts now since the lockdown began, and my experience is that the ward is a half full to a third full. The paediatric wards are quiet. In our hospital, we've agreed that we will have patients in cubicles. Once the cubicles are used, we have a patient per bay. And we've restricted a few of the bed spaces. So we've gone down from a ward of 18 to 12. And each time I've worked, we've had a maximum of 6 patients. So I think what's really important to understand is that what I'm saying is if your child needs to go to A&E, go to A&E. I think that is the best piece of advice I think I can give you. But you know your children, you know your family members with Dravet syndrome, and you know what's right and when it's wrong. And I think when it's wrong, you need to go. Okay, and that's my biggest piece of advice today. I can't say that loudly enough. It's an important decision to make, and you should go if you need to go. And then really the second thing I was thinking about here is about other people's behaviours, which is that actually when you leave the home, you're not going to be able to control people. And actually, you know, might run into people with dogs particularly. I had a dog run at me the other day when I was out for a run, and I was perfectly fine with a dog. I really like dogs. I was more worried about the owner kind of running towards me saying, oh, I'm really sorry, he's really friendly. I was going, yeah, I'm not worried about the dog, I'm worried about you. You can just stay 2 meters away. I can deal with the dog. Dog's fine, it's very friendly. So I think the key thing is, you know, we need to really be thinking about the fact that people are people, and it's about making good decisions. And the best thing you can do is control your own situation and say, well, I'm just going to wait. If there's one person going through a gate, I'm just going to hang back for a minute. And do something here, and then I'm going to go through the gate when it's clear, or go through the narrow part of the street. But there's no good way of doing this. You will probably get within 2 meters of someone on a trip out, on a walk. But think about your local area. Think about where's good to go, and go there. Again, the other thing to think about is about temptations. Is that I stupidly took my son to the park this morning, exactly where the play park is. And that was a really bad move. That took half an hour of undressing. So in terms of peeling it back and trying to get him away. So I think it's really important to be aware of that. Moving on, thinking about siblings. I think it's really important we understand that they're going to be so useful in this pandemic lockdown to help with everybody else's care. Everyone's looking after everyone, that's fair enough. But I think we need to be really aware of making sure that they have their needs met as well, giving them space and time when they need it, letting them have some special time from us as parents, making sure that they're getting what they need. You know, you won't get it right even if you don't. Even if you do get it right, or you don't get it right, you're always going to get it a bit wrong. The children are always going to be a little bit cross. So I think it's really important to understand that we're not going to get it right. But I think just by making sure that we're looking after all the children in the family, that's the best way forward. And I think one of the key things is I'm very worried about extremely eager siblings who want to really desperately help, because that's a really good thing again, but this is a marathon, not a sprint. We're going to be locked down for a while, and what we don't want to do is have that young person put in a difficult or putting themselves in a difficult situation. And I think we have to be extremely careful about the level of care that we're allowing siblings to do. I think that we still have to try and remember where best as possible, that medication administration, for instance, personal care, you know, even supporting seizures, as much as, of course, siblings are going to be doing that because that's just part of everyday life. We have to be very aware that they are still children. And when we're thinking that we need to use them as siblings, as very good young carers, really that's about supervision and play and support and doing the things that kids are good at, you know, and letting them play with their brothers and sisters, and letting them lead activities and do all the fun stuff, lead the PE session in the morning, or playing Simon Says, not necessarily giving medications through gastrostomies or giving personal care. And I'm sure that is extremely unlikely, but I think we should be very, very cautious about what we open up to that sibling, because the reality is that when this ends, they're not going to want to go back to their old role if they've been opened up to new roles, and there are risks associated with them delivering care if they're not ready for that. And they will have plenty of time in their life, I think, later in order to give care. So let's try and protect them as best we can. And then schools, I think, a quick word on schools. I think it's very unique, this situation. I think that everyone needs to talk to their local school. I know some children that have gone to school that are still going to school, children of key workers who have EHCPs, who need that support and that respite for work. And that actually schools are running a very different sort of timetable. I think SEN schools, special education needs schools, of course, are going to be a lot more hands-on than, say, some of the mainstream schools are, which are mainly just putting children onto online work and supervising them. The main thing here is about provision of meals and about a safe place to be while parents are working. Again, this rule about only send your child if you absolutely have to, well, that's a very elastic thing, isn't it? Absolutely have to is an interesting term. Again, it comes back to if you're not working, when of course you have to have your child in school potentially, it's coming back to people's mental health and people's coping abilities within the home. And actually going to school a couple of days a week might not be a bad thing. And again, trying to make the right balance is very difficult, but I don't think there's a wrong decision here. I think it's really based on your individual needs. And I think the best thing to do is to talk to your school and have communication with them about what they've got available and then working out what's going to be best for you. You can look at the local authority to decide what is on offer locally, because it might be that there's a provision in a different school to yours, depending on how the local authority is managing the situation. So these are the criteria at the moment, but again, some institutions have just closed. And then thinking about carers. So again, as I said, one of the things I do a lot is about caring. There's really good guidance. The website link here is the government guidance to managing care teams. As I said, a lot of families have suspended their care team for a period of time, and I think, as we said, that's very reasonable. But I think that there are 3 scenarios that are outlined. No one has COVID-19 or suspected COVID-19 in the care team or in the child or person. No one has to wear PPE in that situation. No one has to be ultra cautious. You can say to staff, I'd like you to wear an apron and gloves or a face mask, because that would just reduce your risk of transmission and risk you getting it. But it's not necessary in that situation. If someone in the home has suspected COVID-19, that person should isolate into a room and should have minimal contact with anyone outside that room. And therefore the care team can continue, but they should be using PPE, personal protective equipment, gloves, aprons, face masks where possible, and goggles if necessary. The main issues here are around droplet creating care, so things like suctioning, managing seizures where there's a lot of saliva, that kind of stuff. And then the third situation is that the child or the person themselves has COVID-19. In that case, it's full PPE for all care staff. And therefore care staff should be informed of that situation, and there should be discussions individually with carers about what they're able to do in terms of their own home situations and their concerns. But one of the beliefs is that we should be quite consistent and firm with our guidance in terms of what means that someone can come to work and what doesn't. And that's something that I would suggest reading this guidance for. And again, one of the things about carers is I think it's very reasonable to say to a carer that in a gentle way, obviously, you're caring for a vulnerable person. I think the best thing you can do is try and act as a vulnerable person and therefore take the lockdown very seriously and try and minimize your output. So going out and making good decisions. Respite care, again, it's very individualized and very localized. You have to speak to your respite provider and see what's on offer. Again, I think people going to respite if it's on offer is a perfectly valid thing to do, but I think you need to make yourself feel confident about what the steps that the organization is taking to protect young people, the person who's going into respite. I think the second issue is be prepared for the fact that if your child goes into hospital or a member of your family goes into hospital or into respite, they may come back needing to isolate, and that's something to be aware of when you make that decision. That it's very important you understand they may come back with a need for the entire household to isolate for a period of time, and therefore make a decision based on whether these are the right decisions for you at the time. So this is resources around the coronavirus, and specifically to people with learning disabilities, people with autism spectrum conditions or similar behavioural situations, and stuff around stress management, parental management, helping supporting children through this time. I'm now going to go on, I hope that was all right. I'm now going to go on and do the questions. There are some questions that came before the webinar, so I'm going to answer those, and then I'm going to jump on and deal with the questions that have come on the chat. And my little box is flashing, telling me that there's lots of messages. So I'll get onto those as quickly as I can. So one of the first questions, to summarize, was saying that our son is 20 years old and he's in a no man's land. He hasn't been transitioned to adult care. He's been on a research trial at a tertiary, at a specialist hospital. And that during lockdown, his consultant neurologist left halfway through the research trial, and he hasn't had a follow-up for quite a period of time. And the family were reassured by the research team under the research trial that he's with, that because their young person is still under that children's hospital, that he should attend there and he would be careful there in that situation. It's very hard to give a complete answer to this question because of time, but I'd be very happy to follow this up with an email with some resources and discussions. But the key point here is, one of the questions was about where does my young person go if they have an emergency? Go to your local A&E department first. Always go to local A&E, and then they will then discuss what the best plan is for your young person. The key thing, if there is an emergency, is for him to be seen as quickly as possible in an A&E department. I would suggest that if the research team have said that he is still valid to go to the children's hospital, that should work. One of the difficulties with not transitioning young people into adult services in a timely fashion is exactly this situation, is that you end up with individual professionals or teams that look after young people, and then when they expand into the hospital because they have an emergency, i.e. they come into the A&E, they need a referral to someone else, instantly the system starts to fall down. Because really the reason for transition is to get into the adult world so you can access all of the services within it. But the key thing here is they should have made provision for someone to follow up. Someone has to be the named consultant. I would suggest getting onto a nurse specialist if you have one, or someone who works within the hospital you have as a link, i.e. the research nurse. Say to them, I need a plan for my young person. I need to know where they're going. I need to know who's looking after them, because if something happens, I need to know what to do. And that has to happen soon. And that would be my biggest piece of advice. But in the terms of an emergency at this current time, get in the hospital, get to A&E, take as much information with you about your young person as you can. I'm sure it's all in your head, and basically deal with the problem that's in front of you at the time. It sounds like a very difficult situation, and I think it does need further discusussion. The next question was about the very common difficulty we're all facing, and it really struck a chord about that you've been locked down for 4 weeks, struggling to get your young person who's around 12 years old off their iPad. It is definitely a comfort blanket for a lot of people, and then concerns about mood and about low mood. I think the key thing here, what I couldn't quite clearly work out, but I'm assuming, is that you haven't left the home at any point. One of the things I would suggest is that leaving the home and trying to find somewhere quiet you could go that's quite local maybe. And I think even if you go out with the iPad and just sit in the park, or sit in a bit of grass, or sit in the forest, or sit anywhere that you can that's quite quiet, I would suggest trying to get out every day. Try to start creating a gentle structure again. Try and sort of put that activity in. Doesn't have to be everything at once. Just get out bit by bit and just try and stretch out that. Going outside will probably make your young person feel better, and I believe it will probably make you feel better. But absolutely, I can see the situation you've given us, the struggle you're in. I don't think you should feel bad about the fact that he's needing a lot of screen time. I think that's absolutely fine. I think the thing to do is just gently start putting in little trips out once a day, and just trying to find somewhere where he can enjoy and pace it. And again, take that iPad with you until it's not needed anymore. Getting outside will make him feel better, for sure. But again, very difficult situation. This is something I've actually dealt with in my own family. I have a foster son who comes for respite, who has complex needs, and his brother was brought home from university. So this is something that I've seen in my own circle. And the concern here was about how long should your son isolate if he's at university. He lives with others who have been out to the shops and done all that kind of stuff. And I believe there was a discussion about whether it should be 7 days of isolation, 14 days of isolation. So the truth here is that you've got a choice. You bring him without isolating him. That's one choice. And as you said, I believe you said that your young person has asthma, quite severe asthma, alongside their Dravet syndrome. So again, I think it's very wise to think about a period of isolation. I think that the one thing to say is that if your son at university hasn't developed symptoms by this point, the quicker that he isolates and gets home, the better. So I would suggest potentially maybe do a 5-day isolation to a 7-day isolation if he's able to do that. See if there's any symptoms. If there are no symptoms, bring him home as quickly as possible and get him in the house. I think that will be helpful for you and for your whole family. I know it's a long drive, you've said that, but again, I agree. I think that he needs to probably isolate for a few days to make sure he's got no symptoms. So potentially probably 7 days, 5 to 7 days, and then bring him home as quickly as possible with minimal contact with the other people in his home from this point forward. If he can manage that, that would be ideal. But again, you know, I know people in the situation who have just brought their adult children or older children home and then literally stopped, gone straight in, had a shower, washed all of their clothes in their suitcase or their bag, steam cleaned, wiped down all of their equipment, all of their stuff they brought home, and then just stayed at home. Potentially trying to limit contact in the home for a few days to make sure there's no symptoms. But again, there's no clear guidance on this situation per se. The clearest guidance on this is that people who live in different family homes or different homes should not move in or see one another. But this is a unique situation where a young person is at an educational institution. So I think a few days isolation to make sure there's no symptoms and then bring home would be the best set. Are we overcautious not having carers? And I believe this question was from a family that young person is normally in a residential setting. I think that overcautious is maybe the wrong word. I think you know, there's nothing wrong with what you've decided not to have care. I think, you know, all you're trying to do is protect your young person. Absolutely right. The key thing here is about ability to cope and manage. Is that really, I know some families that have cut down their daycare and kept their night care and said, you know what, we can cope with the days, that's fine, and we'll just have night carers. And that means that we take away maybe 50% or 20% or 30% of our people coming into our home. I think that's very reasonable, because that means the parents can sleep at night and then get up and do the day. I don't think there's a right or wrong answer, but what I would say is that I think you need to decide between yourselves as parents where you're at, how well you're coping, and decide whether you feel that actually you do need a carer. But it might just be you say, do you know what, we'll just have one for a few hours just to give us both a break, and then we'll return to it. That's fine. So make a decision about where on that spectrum of care you want to be. But I think that it's up to you to have no care. It's up to you to have as much care as you can get your hands on. I think really it's about deciding what's going to work for you as a family, where the balance is on the set of scales between the risk of someone potentially bringing it into the house and not. But again, simple things like taking temperature of your carers before they enter the home, making sure they hand wash as soon as they enter the home, leaving their bags near the front door and not taking it into the living spaces or the rooms, wiping it down, changing their clothes when they arrive on shift, using PPE. These are all things that minimize the risks. I know one family have asked their carers to have showers before they start, and carers have said, that's fine, I don't mind. Yeah, whatever. We'll do whatever needs to be done. So it's really about working out what's going to work for you. And the last question that was on the emails was about a young person who's quite ataxic or wobbly, tends to fall over quite a lot, and the parents were asking about getting a chair to give themselves a bit of respite and to give their young person less risk. I think that's absolutely right. I think definitely do that. Peapod chairs are awesome. They're just like lovely armchairs. I will put some funding on the resources page when this goes out about where you can try and get grants for chairs. But I would think that sitting in a seating system is a very good idea. So the first question here is it safer for our children to be at home or at school? Trying to compromise between safety and the stimulation they get at school. I completely agree. I think one of the things I'm so keen on is that understanding that education is so important, but it's not just education, it's the being with peers, being with other people in their lives, being with staff, being with the people they know. I'm seeing a lot of lonely children, really, really lonely children, and I think that, and children that are feeling out of routine and out of norm. And I think that one of the decisions here is that, yes, there's a small risk within that setting that they may go in and they may pick up COVID-19 coronavirus, but there's also an extremely big risk to their social well-being, to their mental health. And actually, I think maybe there's a compromise between saying, you know what, maybe we'll do 2 days, maybe we'll do a day a week. You know, in for a penny, in for a pound, it's got to be an individualized choice. But I think there are definitely a balance to be struck. My personal opinion on this is that speaking to the school and seeing what the situation is there, I think that you need to talk to your head of school or talk to the people in charge at school and say to them, look, what's happening? What's the reality? I need to make a decision. Once you've got all the information, make a decision. And I think that going to school, I think, is a really perfectly acceptable and good thing to do if you feel that that's something you can allow yourself to do. And I think that's what I would ideally like more children in school than are, probably, because I do think there are children who really need that situation. Definitely need to be going into school. So I agree completely. I think where possible, we should be saying positively, yes, I will, if things seem good. Next question. Yeah, thanks for the resources. Perfect. Care guidance. That's messages, questions. Do you recommend giving vitamin D whilst not going out much? Definitely. Definitely vitamin D. We really like vitamin D. So yeah, definitely. I think, to be honest, having a child with epilepsy, giving vitamin D standardly every day or giving a vitamin every day is a good thing anyway. So yeah, go for it. And definitely while they're not outside as much, because the weather is what's going to give people their vitamin D mostly. It's that or oily fish, and let's face it, most children and young people do not like eating oily fish. So I think sunshine's where to go. So definitely vitamin D supplements are a really good idea. You can order them in. Holland & Barrett is open if you do need, or you could probably potentially ask your, if you see any of your doctors, speak to any of your doctors on the phone, on a telephone consult, you could potentially ask them if they'd be willing to do a prescription and tag it onto your medication. But an over-the-counter vitamin D supplement would be perfectly acceptable.
Well, thank you very much, Neil. Is there any other questions at all that we can know? They're not. Well, we've got to nicely just before 9, 2 minutes before 9. I think that was really, really helpful. I certainly found it very interesting, and I hope the rest of the guys did as well. As Neil has said and Helen has said, we will have this presentation up live in the next couple of days, and please do come back and you can reference all the links that Neil have. If you do have any other questions, please do get in contact with us. You know, the team are here, and we are definitely here to support you all. So thank you so much to Neil. That was brilliant. And I think we'll call a close to the webinar. So thank you very much.
Thank you, everyone. It was so nice to be able to do that. Thank you, and I hope you're all taking care. Good luck, and have fun as much as possible.